Hi, everyone. Thanks for coming. I know that people will still be trickling in here, but I wanted to go ahead and get started just because I know that everybody wants to get to this and Janice has a lot of stuff to cover. My name is Jackie White. I am the Director of Outreach and Healthcare Access for the PEAL Center. Thank you for coming. This is Federal Threats to Medicaid. Janice Miner will be presenting. Just a couple things. Heather, can you go to the next slide? Please, while we're on, try to keep yourself muted, and you can use the chat to make comments or ask questions, but we're gonna wait until the end of the session, probably to address questions, just because there's supposed to be a lot of people on here, and I don't want it to get chaotic. And then if you do have a question, please try to refrain from disclosing too many personal details, and let us know if you need help turning on closed captioning. Otherwise, you guys probably are all familiar with PEAL or might not be, but our mission is to educate and empower families to ensure that children, youth, and young adults with disabilities and special healthcare needs lead rich, active lives as full members of their schools and communities. And with that, I'm going to let Janice Miner from the Pennsylvania Health Law Project take over and share her slides. And thank you for attending and welcome.
Thanks, Jackie. Jackie, is my PowerPoint visible now?
No, not yet.
So maybe I'm sharing. So does Heather need to
Heather, maybe stop sharing.
I have stopped sharing.
Okay, Janice, can you try to share again?
I can. Yeah. All right.
Believe it or not, we tested this ahead of time and it was working great. But bear with us 1 second, everybody.
Yeah, I think once Heather pulled hers up, I can't. I'm gonna click out of this. If it disconnects me completely to the Zoom, then I'll have to go back in. So just give me a second here.
There we go.
We can see it. Just make it a slideshow when you're all set.
Right. Are you seeing both like the first and the second screen?
Yep, you just need to switch to presenter view. Yep, there you go.
Okay.
It's all good. All right, thanks, Janice. Take it away.
Sure, thank you. All right, so good evening, everybody. Thank you for joining us. Important topic that we need to discuss, I think, this evening. I want to start with just some information about my organization, the organization that I'm with. It's not my organization, the Pennsylvania Health Law Project. So for folks who may not be familiar with the Health Law Project, we are a statewide nonprofit public interest law firm, and our work focuses on helping people with Medicaid eligibility and with access to Medicaid services. We also help, to a lesser extent, people with Medicare, in particular, people who may be eligible for both Medicare and Medicaid. And so the primary way people get to us is through our helpline that operates Mondays and Wednesdays. And folks can see that our helpline number, up on the screen. Our services are free. And anybody can call the helpline. So it could be somebody you know, calling on behalf of themselves or a family member, you know, a doctor, a social worker, anybody can call our helpline with any issues related to, you know, Medicaid eligibility, whether or not somebody might qualify for Medicaid, somebody might have Medicaid and their Medicaid was terminated. They might know why, they might not know why, trying to get help with things like a Medicaid termination, as well as, you know, people trying to access services through Medicaid who may have a service denial, something that was prescribed, you know, for themselves, for their kids, and Medicaid denied it, or their Medicaid managed care plan denied it. Those are all the kinds of things that, you know, we can assist people with. And then in addition to our direct client work, from that direct client work, we also do a lot of policy advocacy with the state officials, the various state officials responsible for the Medicaid program. And one of the primary ways we do that, we are the legal representation for the Consumer Subcommittee of the Medical Assistance Advisory Committee. And so we meet with various state officials every month, meet with the consumers who are assigned to that and on the Consumer Subcommittee, and then raise any number of issues that consumers are seeing, you know, with Medicaid, as well as, you know, a whole host of issues that we might be seeing at the Health Law Project. And so, you know, our policy advocacy is geared towards trying to improve various parts of the Medicaid system and improving the system overall. And then the third kind of prong of what we do is what we're doing tonight. You know, trainings, presentations, we do webinars, we do in-person trainings, and then create a lot of written materials. Our website, which I apologize is not up there, is PHLP.org. Lots of written materials on our website, fact sheets, guides, manuals, you know, everything from a 1 or 2 pager to a 30 or 40 page guide on various pieces of, you know, the Medicaid system. We also do a monthly newsletter that is sent out electronically only. Anybody interested who's not receiving our newsletter, you know, please just email us at staff@phlp.org. And we'll be sure to add you to that emailing list for our newsletter. Our newsletters are also archived on our website, so folks can also, you know, go onto our website and, you know, take a look at past newsletters, you know, especially ones, you know, perhaps people interested in ones that are more recent over just these last couple months or so. So for folks who, you know, aren't familiar with us and don't know what a resource we are for people, you know, on Medicaid or trying to figure out if they're eligible for Medicaid, or, you know, trying to access services through Medicaid, please keep us in mind. You know, please call our helpline. So I want to start tonight just by talking about, you know, just some Medicaid basics. So a little bit of, you know, Medicaid 101 before, you know, we get into, you know, what are the current federal threats to Medicaid, and what are things that we, those of us concerned about Medicaid, those of us on Medicaid, or our kids having Medicaid, you know, what are the things that we need to be paying attention to, and perhaps educating others about, you know, under the current, you know, federal administration and proposed changes to the Medicaid program. So just in, you know, in terms of some Medicaid basics, Medicaid is both a federal and state funded program. That federal state funding, that match, varies a little bit from state to state. In Pennsylvania, the federal government, through the Center for Medicare and Medicaid Services, pays 55% of the costs for every individual on Medicaid in Pennsylvania. And then the Pennsylvania match is that remaining 45%. So for every individual, at any given time enrolled in Medicaid in Pennsylvania, 55% of the costs of that person's Medicaid enrollment is coming from the federal government, 45% from the state. So obviously that federal match is really important. And as you can see, even more than 50% of the cost to insure any Pennsylvanian who's on Medicaid. In terms of, who's on or eligible for Medicaid, Medicaid is considered an entitlement program. And what that means is, if somebody meets the eligibility criteria for Medicaid, and we're not going to get into all those, details tonight about, the given criteria for any, person who might be eligible. But if they meet the criteria for Medicaid eligibility, then they get the Medicaid insurance. And generally people are approved for Medicaid, for a year at a time, barring something, that could potentially change their eligibility. And then have a Medicaid renewal for their eligibility. People don't just get Medicaid and remain Medicaid eligible indefinitely. At least once a year. For some categories of Medicaid, it's more frequent than that. People have to have what's considered a renewal for their Medicaid coverage. And so in terms of, who is potentially eligible for Medicaid, it's a health insurance program for low-income kids, low-income adults, and older adults, low-income individuals with disabilities, including certainly kids with disabilities. And in order for anybody to be eligible for Medicaid in Pennsylvania, they have to fit a category of eligibility. And there are many categories, many ways somebody could be determined eligible for Medicaid. Kids, in and of themselves, is a category of Medicaid. Pregnant women is another category. Older adults, considered in this context age 65 or older, is another category of Medicaid. And additionally, Pennsylvania has several home and community-based waiver programs. They are Medicaid waiver programs. And so people who are determined eligible for one of Pennsylvania's home and community-based waiver programs also then, if they don't already have Medicaid insurance, then also have Medicaid health insurance, in addition to being, on that given waiver and whatever services might be a part of, that particular waiver program, the Community Health Choices waiver, or one of the intellectual disability waivers, or the autism waiver. Examples of, some of the waiver programs in Pennsylvania. And then, as many people probably know, Medicaid can have different names in different states. Medicaid is the federal name for the program. In Pennsylvania, we call our Medicaid program medical assistance. I believe in California, they call it Medi-Cal, different names in different states. But, whether we say Medicaid or medical assistance in Pennsylvania, we're talking about the same thing. We're talking about the federal Medicaid program. Okay. So looking, both across the US as well as more specifically to Pennsylvania, there are more than 70 million people in the United States currently enrolled in the Medicaid program. That is more than 1 in 5 Americans on Medicaid at any given time. across the country, and another 10 million kids that are on the CHIP program. CHIP is Children's Health Insurance Program. And the CHIP program is for kids who don't otherwise qualify for Medicaid, but are also uninsured. And so there's another 10 million kids across the country on the CHIP program. Specific to Pennsylvania, and these numbers are recent, probably as of a week or two ago. Obviously, they can change a bit. Any given day, somebody's getting determined eligible for Medicaid, while somebody else might be terminated for Medicaid. But Pennsylvania has over 3 million people on Medicaid. We have close to 13 million people in Pennsylvania. So it's a very high percentage of Pennsylvanians that have insurance through Medicaid. And then you just, see there on the screen some of the breakdown, of people under 21, as well as, basically kids for purposes of this discussion, and low-income parents, 1.3 million, people with disabilities, close to 500,000, people 65 and older, over 400,000, and people in what's referred to as the Medicaid expansion category, which covers low-income adults under the age of 65 who do not have Medicare insurance. We have over 830,000 Pennsylvanians on Medicaid, in that category now. 35% of Pennsylvania births are to women on Medicaid. Again, a really significant percentage. It's a lot of women, while they are pregnant, on Medicaid and give birth while they're covered by Medicaid. 48% of kids, so almost half of kids with special needs in Pennsylvania, are on Medicaid. And I think another kind of important number or percentage to be aware of, there's the percentage of people on Medicaid, in these different categories of Medicaid. But then, of course, there's the Medicaid, expenses. It's, who's using most of Medicaid dollars. And as we would probably imagine, if we were taking a guess, older adults and people with disabilities in Pennsylvania make up 77% of Medicaid spending. So as I think we would expect, people that have health conditions, significant health conditions, disabilities, and those of us in that older adult category, as we age, we tend to have more health issues. And so our healthcare needs and our healthcare expenses increase. So again, and I think some of this, I've already touched on, for somebody to be eligible for Medicaid in Pennsylvania, they have to be, a resident of Pennsylvania, they have to be a US citizen or otherwise, meet eligibility criteria as a non-citizen. And then they have to fit into a category. And then within that category, there are income limits. Some categories have both income limits and resource or asset limits. And people have to then, under those categories, meet both the income limit and the resource limit to be eligible. There are no resource limits for kids in determining eligibility for Medicaid, for pregnant women, or for adults, non-disabled adults or adults without Medicare. Those categories have income limits only, no resource limits. Other categories of Medicaid then have both an income and a resource limit. So it's a complicated program just in terms of the eligibility criteria. Okay. And then just, another snapshot of, who's Medicaid helping in Pennsylvania. Lots of people, but certainly kids, including kids with disabilities, pregnant women, adults with disabilities, 42% of people on Medicaid are children. In Pennsylvania, we have over 88,000 kids on Medicaid with special health care needs. 1 in 4 Medicaid recipients has a disability. We have another 190,000 Pennsylvanians who are on Medicaid and receiving and enrolled in one of Pennsylvania's home and community-based waiver programs. So again, just, giving people, a snapshot and a frame of reference for, in Pennsylvania specifically, who are the folks that need this insurance, are eligible for this insurance, and are getting the coverage currently through Pennsylvania's Medicaid program. And then just, a sense of what does Medicaid cover? For those of you on Medicaid or with kids on Medicaid, you likely already have a sense of, Medicaid is very good health insurance. It provides a very comprehensive array of services, prescription medications, medical care, physical health care, behavioral health care, nursing facility care. Medicaid is the highest payer of nursing facility care in Pennsylvania and across the country. Medicaid covers various therapies, again, behavioral health therapies, physical health therapies. Medicaid also provides transportation to medical appointments, either through a mileage reimbursement program or through paratransit. All of that is a part of, the very comprehensive Medicaid program. With the exception of 2 categories in Pennsylvania, people do not pay a monthly premium to have Medicaid insurance. And once they have Medicaid coverage, their out-of-pocket expenses are very low. In the case of kids, kids in this context being under the age of 21, kids have no copays for any of their services on Medicaid. So it's very good, very comprehensive coverage for people who are low income, kids, people with disabilities, older adults, and is therefore very affordable for people, as it was designed to be. And just, wanted to share, just an example for, again, kind of a frame of reference, for folks, income levels to qualify for Medicaid, again, with some exceptions, tend to be very low for most Medicaid beneficiaries. For example, in 2025, for a single older adult, and again, in this context, older adult means somebody age 65 or older, there is both an income limit and a resource limit for an older adult to be eligible for Medicaid in Pennsylvania. So currently, 2025 income limits, and for an older adult to be eligible for Medicaid, their gross monthly income has to be less than $1,304 a month, and they can't have more than $2,000 in countable resources. So that means money in a checking account or a savings account or any retirement account. So, the program really is for people, very low income, very low resources. Another example, income limits, and income limits for kids vary. There's an income limit for newborns to kids age 1, for kids 1 to 5, and then a third grouping for kids ages 6 to 18. The younger the child, the higher the income limit for Medicaid. And so again, just another example, kids age 6 to 18, in a household of 3, for example, that monthly income would have to be less than $3,065 a month for, a child age 16 to 18 to be eligible for Medicaid in Pennsylvania. And again, the program can and does look different, state to state. These income limits can vary some, from state to state, but Medicaid overall across the country is for, low income individuals, in particular kids, older adults, adults with, disabilities. Pennsylvania Medicaid also covers kids with disabilities, whether or not they're otherwise income eligible for Medicaid. That is not true for every state's Medicaid program, but currently that is a category of eligibility for Pennsylvania's Medicaid program. And I think another thing that is helpful to keep in mind in the context of the Medicaid program is, Medicaid doesn't just benefit the individuals who are receiving the Medicaid insurance. Medicaid dramatically reduces uncompensated care to hospitals that would otherwise increase the hospital care for all of us, drive up premiums on Medicare insurance, on employer insurance, on other commercial kinds of insurances, because, otherwise somebody has to pay those costs, and Medicaid is, significant in paying for, otherwise uncompensated care to hospitals, because hospitals have federal rules that tell them, somebody presents in an emergency room in what is a critical emergent situation, hospitals have to treat them, whether or not they have insurance. And sometimes in those situations, people may be uninsured, but then could end up being eligible for Medicaid. And so it's significant that, Medicaid can be paying for, otherwise uncompensated care for people getting care, in a hospital, whether it's emergency room or otherwise. Medicaid dollars certainly help the economy. Medicaid is, of course, paying providers. Pennsylvania's Medicaid program is largely a managed care program. So the Medicaid dollars, go from this state to the managed care plans, and then the managed care plans are responsible for providing care. And so, those dollars by and large are then all getting, spent in the state of Medicaid, in the state of Pennsylvania. Medicaid also covers things like vaccines and COVID shots and flu shots and, inoculations for various things that then, of course, increases the likelihood that, that all of us are healthier. So let's talk now about, why this webinar tonight? Why, why are we now in particular very concerned about potential cuts and threats to Medicaid? And at this point, those threats are all occurring at the federal level with, with the government's current federal administration. And this administration wants to cut $880 billion in federal spending. It is fiscally impossible, based on how the federal government spends its money and what programs the federal government pays for, with Medicare, Medicaid, and Social Security being three of the largest federal programs, that largest as in who they help and in what they cost. And as of now, this federal administration is saying they aren't cutting funding to Medicare and aren't cutting funding to Social Security. And so it only leaves Medicaid for those cuts to happen. And when the current administration's goal is to cut $880 billion in federal spending, it is fiscally impossible to make those cuts without cutting Medicaid funding to states. So what are some of the ways that the federal Medicaid funding could be cut, so that then the federal government saves money, on the backs of people who need or already have Medicaid? One way, we talked earlier about how is Medicaid currently funded. It's funded by the federal state match, with, in the case of Pennsylvania, federal government paying 55% of the costs of Medicaid, and then Pennsylvania state government needing to budget accordingly to pay for the other 45% cost of the Medicaid program. So one of the ways that the structure and the funding of Medicaid could be changed is what's referred to as per capita caps. And so instead of the very clear and predictable funding of, 45 cents on every Medicaid dollar has to be paid by the state, the other 55 cents gets covered by the federal government. Instead, the federal government could decide on, a fixed amount of federal funding, for each person on Medicaid. And then if those actual costs exceed that fixed capitated rate that the federal government would provide to the states, then the states are making up the difference. And generally, certainly true for Pennsylvania and likely every other state, states don't have that difference. They don't have the money sitting somewhere just, to then pay for the additional costs if the federal government would switch, what is the current funding mechanism, into this per capita caps. One of the other things that we're hearing as a possibility is that the federal government could eliminate what's called the enhanced federal match for people on Medicaid in what's referred to as the Medicaid expansion category. People in that category of Medicaid, the federal government is paying 90% of their Medicaid costs, and the state only pays for 10%. And so right now in Pennsylvania, we have over 830,000 people in that Medicaid expansion category. That category is a result of the Affordable Care Act, what some people refer to as Obamacare, the federal law that was passed in 2010. And as a way to, that law expanded Medicaid, basically created an additional category of Medicaid to provide insurance, Medicaid insurance for low-income adults. And the way that the law did that, in order to not burden the states with so much more of the cost for those low-income adults, they dramatically increased that federal match. And that federal match has continued for all individuals in Medicaid in that expansion category. So, and they could, eliminate that enhanced match and reduce it down to, the 55% that applies to all the other Medicaid categories. That would be a huge additional cost to Pennsylvania that in all likelihood, Pennsylvania simply couldn't absorb. Other ways that the federal administration could rework the funding of the Medicaid program is to, again, eliminate that federal match system that exists now for every state's Medicaid program, and just design the Medicaid program in what's referred to as block grants, where the states get just a single lump sum of money to cover Medicaid expenses for all people eligible for Medicaid in that given state. You know, regardless of whether enrollment numbers are up or down, regardless of the costs, or whether costs of care are, you know, increasing as they routinely do in healthcare. And so again, that, you know, that lump sum, and I think we can hear, you know, congressmen and women, you know, really just putting a potential positive spin on, you know, the block grants, and, you know, it's the states who should be deciding how these Medicaid dollars get spent. And these decisions are always better made at the state level. And, you know, while some of that in terms of the decision making could be true, it's still in the end, it's a savings to the federal government. And there's no way to have federal savings, you know, in this block grant style of lump sum, you know, without it costing money to the states, money the states simply don't have. The fourth way that we continue to hear about that the federal government could change the Medicaid program is to require Medicaid work requirements for what is often referred to as, you know, quote unquote, able-bodied adults. And so I think it's helpful to talk a little bit about, you know, why is that, you know, a potential problem? First of all, the federal government would not impose work requirements on the quote unquote able-bodied adults as a savings to the federal government unless it would result in a savings. And the reason it would result in savings, you know, to the federal government is because, you know, despite the fact that 65%, at least in Pennsylvania, Medicaid recipients do work, there would be, you know, exceptions for people like people with disabilities that would not have to meet those work requirements. But when people can't prove they are working or can't prove that they are exempt from the work requirements because of disability, you know, showing, you know, that can't show they're working because of red tape. I think anybody on this, you know, webinar tonight who's, you know, had to work with Medicaid application or renewal with the county assistance offices knows that that system is very overwhelmed and understaffed. And so if we add to an already overwhelmed, understaffed system in Pennsylvania or any other state, by saying now people have to show they're working and provide that, you know, verification every however often it would be, and all of those, or show why they're exempt and prove why they haven't, you know, exempt because of disabilities. All of that creates red tape, paperwork that has to be going back and forth between Medicaid recipients and the county assistance offices. And what ends up happening then is people lose their Medicaid. I think many of us already know people, you know, there's already significant amount of Medicaid churn, you know, meaning people have Medicaid and they lose it. In some instances, that churn is because they're no longer eligible. That's how the system's supposed to work. But too often people lose Medicaid for these very reasons: the red tape, the not being able to, you know, not get the information they needed, or they didn't get it back to the assistance office in time, or they got it back to the assistance office in time, but the county assistance office is saying they never got the pay stub or the renewal form or the bank statement, any number of things that are already required for people to submit when they're applying or reapplying for Medicaid. And so to add more demands, more paperwork to an already overloaded, understaffed system will just result in more people losing Medicaid. And quite honestly, that would be the intent. That would be the federal government's intent of imposing Medicaid work requirements. Because if the federal government's goal is to reduce federal spending by $880 million, and they're targeting Medicaid, and they impose Medicaid work requirements, clearly those work requirements are put in place to knock people off the Medicaid rolls. And that's just what will happen. 2 states have already had permission from the federal government to impose Medicaid work requirements on their able-bodied adults in their state. And it backfired in one state to the point where the state just chucked that whole idea and are no longer imposing Medicaid work requirements, because it just resulted in too many people losing Medicaid. It did not result in people, assuming this is the idea, more people working, or people working more such that they now have affordable insurance through their job. It simply, backfired. And when people who are otherwise eligible for Medicaid and are working lose their Medicaid health insurance, it's really, for any of us, increasing the likelihood that we're not healthy, and then we're not able to work, because we now no longer have access to our health insurance and our health care. So what are the potential, and potential is the important word, I think, right now, when we talk about, the cuts in federal Medicaid and the potential impact on Pennsylvania. And we stress potential impact because all of this is occurring right now, at the federal level, within Congress, within the Senate and the House of Representatives, at the United States Congress. And so, we don't know, the administration responsible, which is the Department of Human Services in the Pennsylvania government, responsible for the running of and the funding of Pennsylvania's Medicaid program, don't know what's going to happen yet. Don't know what kinds of cuts might be happening. Don't know if this is going to, turn into a block grant scenario, or a per capita cap scenario, or a Medicaid work requirement, the thing that looks really most likely, among others, to happen. So, the state doesn't know yet. What would they do? What would happen if that enhanced match of 90% versus the 55%, is cut for that over 830,000 Pennsylvanians on Medicaid? Then the state has to make up that difference. What will they do? But we understand the Medicaid program enough to know that there's only so many ways that the state can make up for this. And they can't make up for it. And so if these federal cuts happen to states' Medicaid program, then it leaves Pennsylvania with really a handful of bad options. States could decide to cut benefits that are provided under Medicaid. They could cut the eligibility criteria. So, for example, right now, for, an older adult in Pennsylvania to be eligible for Medicaid, they have to be, that $1,304 a month that I mentioned on an earlier slide, that's 100% of the federal poverty level. So states could determine that people only are eligible for Medicaid under that category if they're within 75% of the federal poverty level. So they're cutting and making it, less people eligible by virtue of reducing the income limit. States could cut payments to the providers who accept Medicaid. I'm sure, as most of us can imagine, that then results in all likelihood in a shortage of providers who accept Medicaid. As it is, there are certainly providers across, Pennsylvania that don't accept Medicaid at all. And so if the state then needs to cut those payments and pay all those various medical providers less, then those medical providers, they're not obligated to take Medicaid, just like any medical provider currently is not obligated to take Medicaid. So the result then could likely be that we have providers that just no longer take Medicaid. And so now people are going to have difficulty accessing services, and in areas where there's already provider shortages. Anybody who's, tried to access, mental health services, other kinds of behavioral health services, dental services, there's already not enough providers. People living in rural parts of Pennsylvania, which is the majority of Pennsylvania, is rural. There's already provider shortages, not enough hospitals in the area, not enough of all kinds of providers, people having to travel far to see a provider, and including people with Medicaid. And so if those payments are, cut to the Medicaid providers, now we have a real potential concern that those providers simply no longer accept Medicaid. States could create various waiting lists for Medicaid eligibility. And states could charge monthly premiums to, again, it could be to certain, groups of people on Medicaid. It could be, folks who have been around and doing this work as long as some of us at the Health Law Project may remember when Pennsylvania, separate for anything that was happening at the federal level, when Pennsylvania was looking at charging premiums for parents of kids on Medicaid, when their kids qualify because of their disability or health condition. And Pennsylvania, very aggressively explored that. And I think a lot of very good advocacy from families, from organizations like ours and many others, pushed back at the state level and said, you're just making this Medicaid, unaffordable. And again, that would be the point of the states having to make that, hard decision. If you're charging monthly premiums for various, or any given category of people on Medicaid, and they can't afford those premiums, that's of course how the state saves money. The state's really not saving a lot of money by collecting those payments. It would certainly help, but the idea would really be charge those premiums such that people can't afford them, and then they drop the Medicaid coverage altogether. The Medicaid premiums also, as we said earlier, anything that adds bureaucracy and red tape, to an already stressed Medicaid eligibility system is, going to result in more costs on the bureaucracy end and or more people losing Medicaid, even if they're still eligible. Okay. So what can any of us do? Certainly, what you're all doing tonight, taking from your time to educate yourself more on what's happening, what could happen, what are the concerns, and again, at this point, happening at the federal level. educating yourself, educating other people. In the next slide or two, I have, links to other kinds of resources. I always kid that like nobody invites me back second time to a party, because if I'm in there telling people about, correcting them on their misnomers about, fraud and waste and abuse in Medicaid, or, how many people are on Medicaid that aren't even eligible. And, I've done this for almost 25 years. So I know what we're talking about in terms of Medicaid and how Medicaid works and how Medicaid eligibility works. And so I'm always challenging people who make those kind of comments to say that that's not accurate. That's absolutely not accurate. We don't give Medicaid to all the undocumented immigrants, as a friend at Bunko said a couple months ago. And I told her that's wrong. It's absolutely wrong and not helpful to repeat things that aren't accurate about the Medicaid program or any other program. So people being able to continue to, educate yourself, educate others, share your story, your family story, your child's story, your own story, stories that from the neighbors, from family members, whoever story and know well enough, share those stories. Congress was in recess for 2 weeks. One of those, over the spring break. One of those weeks is already gone, but they're still in recess through the end of this week. Those, our U.S. representatives are home in their home districts now. Certainly, meeting with people in person, with our representatives in person or by phone, is not the only way to do it. And certainly don't have to be limited to, this next week when Congress is, in recess. But it's, it's a good time for people who, have the time and the desire to, reach out and perhaps even try to schedule an appointment with, if not your representative, one of their staff, and go in and explain to them, what does Medicaid mean to you or to your family or to your child? As I was preparing all this information, specifically for, folks that, families of kids with, on Medicaid and families of kids with significant, health issues or disabilities, one of the things that occurred to me was, many kids on Medicaid in Pennsylvania, in particular, kids with special health care needs, with disabilities, many of those kids also have private health insurance, almost always through a parent's employment. So why then do those kids even need Medicaid when many of those kids on Medicaid already have insurance through a parent, through a parent's job? I think those are really important stories to share. Parents with kids with special health care needs enroll their kids in Medicaid, even when their kids have other health insurance, for a reason. Our senators and representatives need to know those reasons. What is it that the private health insurance isn't covering that then even requires families to apply for Medicaid, to work through that bureaucracy of the application and the county assistance office, to complete those annual renewals for their child to remain eligible on Medicaid? Why are families doing that when so many of these kids on Medicaid already have health insurance? Where are the gaps? What are the problems with the private health insurance? Is it that private health insurance has a $3,000 annual deductible? Is it that private health insurance, has limits or caps on how many kinds of, how many physical therapy appointments a child could have, or, are the co-pays or the co-insurance so prohibitively expensive for families that they then need Medicaid. What services is Medicaid covering that only Medicaid covers? And the child's private health insurance, that employer-related insurance, doesn't cover. I think lots of, our government officials don't necessarily even know or understand that in Pennsylvania and other places, kids have other insurance besides Medicaid. And as many of you know, if you or your child's on Medicaid and have other insurance, Medicaid pays last. Medicaid is always the payer of last resort. So it's the private health insurance that always has to pay first for any benefit, any services that private health insurance covers. And then Medicaid's paying secondary. But I think really important to, to even share that part of the story for, any of you who have, or your kids who have Medicaid in addition to private health insurance. Why is there the need for both? And what is it that Medicaid provides, above and beyond, or makes affordable that private health insurance? I think that's, an important part of the stories that, that our senators, that our congressmen and women need to hear and understand and know what that impact would be. If your child has both private health insurance and Medicaid, or your child has just Medicaid, what's that going to mean to your child's health and health care, and to your family and to your family's finances if they're no longer eligible for Medicaid, or they're charged a premium for that Medicaid with a premium that perhaps families are already paying for that private health insurance. Where does that leave that, those kids or those families? Those are the stories that Congress needs to hear and needs to hear now, because this is potentially moving very quickly. And then I just wanted to also just share some resources. The first one is from the Pennsylvania Health Access Network, where they, put together some materials to help people who may want to create a video and tell your story or your child or your family's story, in a video. That's the first link in the Tell Your Story in video. I also added a link to the National Health Law Program. They have been doing a lot of work on educating people on Medicaid, on trying to defend why people need Medicaid across the country, and why it's so detrimental for so many to lose their Medicaid. And they've created lots of materials, lots of fact sheets. They have several just on the problems with Medicaid work requirements, just lots of really fairly easily digestible information, considering, Medicaid itself is a complicated program. But there are lots of resources on the National Health Law Program's website. And as you can see there, a link specific to Medicaid defense. There's the next link is some helpful data. It's the Department of Human Services data dashboard, as it's referred to. And again, just another place to get some kind of quick data, information, numbers, the kinds of things that can be helpful, again, whether you're talking to, your federal, your US senator, or your US congressmen and women, or, your neighbor or anybody else that you're trying to educate, including yourself, on, what is Medicaid exactly? Who is it covering? Why is it important for kids, for pregnant women, for adults with disabilities? Why is it important to keep people out of nursing homes? Medicaid pays for nursing home care, and that's a good thing. But Medicaid also, in Pennsylvania, we have 6 home and community-based waiver programs, 3 for individuals with intellectual disability, the autism waiver, obviously it's for adults with autism, the community health choices waiver for adults 21 and older with physical illnesses and disabilities, and the OBRA waiver for people with developmental physical disabilities. All of those waivers are intended to provide supports that people need in their home and community, so they're not in a nursing home or not in some institutional level of care. Those are all Medicaid funded waiver programs. And, the impact on all of those people. And some of you may already know, for the intellectual disability waivers in Pennsylvania and the adult autism waiver, all 4 of those waivers already have and have always had waiting lists. So you already have people and families waiting to get access to those waivers, to get the services and supports they need to be living and thriving in the community. And now if we have Medicaid cuts, we can only imagine, what will happen with those waiting lists, and will they become even longer? Pennsylvania, in last year's budget, Governor Shapiro made some really great strides in reducing those waiting lists for those intellectual disability and waivers and the autism waiver. We still have close to 8,000 people in Pennsylvania on a waiting list, just for those 3 ID waivers. But that number is down significantly from even a year ago. We'll just see those numbers increase if we have any cuts to the Medicaid programs. And so, that data dashboard, that Medicaid and PA data, just, gives you lots of kind of much more, easily digestible information about who's on Medicaid in Pennsylvania, and why this program is so valuable to so many people. And then just the last resource there, as I said, if folks would like to receive Pennsylvania Health Law Project monthly newsletter, please just email us at staff@phlp.org, and let us know, what email you want it sent to. Let us know you want to start receiving our newsletter, and we'll make sure we get you added to that newsletter mailing.
Okay.
Jackie, do we have questions?
That's what I was just gonna say. At this time, we'll stop the recording, so if anybody has any questions, feel free to unmute and ask.